So, you want to learn about bone marrow transplants, or as they're alternatively known, stem cell transplants. Have I got the video just for you? Welcome back, my name's Tyler Blah. I am a final year medical student here in Sydney, Australia, and I'm also a survivor from a bone marrow transplant as well. In fact, I am now just past a year and a half since having my bone marrow transplant, and so I figured today would be, well, it's a really good opportunity to talk to you about, well, what is a bone marrow transplant? And I suppose today we could also talk about some of the misconceptions and help for you to understand and define what really goes on with a bone marrow transplant. Now, before we get into today's video, if you could please, for the YouTube algorithm, like, share, subscribe, and according to my analytics, 94% of my viewers are not subscribed. So let's see if we can get that to 92%. I'm not asking a lot, just 2% of you, if you could hit that subscribe button, that could be pretty cool. Otherwise, let's get straight into the content. Now, in general terms, the bone marrow transplant and the stem cell transplant, they are used quite interchangeably when it comes to the actual practice in medicine, specifically hematology. And when they're used interchangeably, they're essentially trying to define one common process. And that process really is just 3 steps when you look at it. We're collecting healthy stem cells from either the patient themselves or a donor. The second stage is to give the patient essentially chemotherapy and or radiotherapy to treat their diseased cells. And the third final stage is to infuse the healthy stem cells that we've extracted from the patient or the donor to the patient that just underwent that treatment to their disease cells, so that this can allow for the creation of a new population of healthy blood-forming cells. And so that's kind of the gist of how and what a bone marrow and stem cell transplant is. However, let's get into a little bit more science and essentially help you understand a few of, well, the key phrases around here as well. So, let's begin with, what is bone marrow? Bone marrow is essentially the tissue that fills the cavities within your bones, and from there, that's where most of your blood cells really are made. Whereas stem cells, technically, describe a special kind of cell that is also found in your bone marrow. However, these can be destined to become, well, multiple different kind of cells. These are cells that, well, in a way, have not really quite decided what they're going to become yet, and they can become your red blood cells, your white blood cells, and your platelets. They've kind of got that infinite potential. That's kind of the part around what a stem cell really is. Now, the big question, what is treated with these transplants? Now, when you're looking into a transplant like this, bone marrow or stem cell, but as I said before, they're essentially the umbrella term, so I'm just going to stick to bone marrow transplant, because that was the term that was used with me most during my treatment, although it really means the same as stem cell transplant in most cases. A bone marrow transplant, in essence, is used to help treat, well, the hematological malignancies, so there are your blood cancers, as well as a few other blood disorders that can occur, well, as well. Now, of course, you don't need a bone marrow transplant in order to be treated for your blood cancer. It's just in some situations, it can be quite necessary to advance to that transplant in order to reach the cure for that blood cancer. An example of that is my specific type of AML that I was diagnosed with, CBF inversion 16. That kind of leukemia actually doesn't require a bone marrow transplant in almost all of the cases. However, because I relapsed with my subtype of leukemia, what that then meant is that I was better suited, due to my relapse, to have a bone marrow transplant. So it can kind of steadily evolve, and that's kind of the thing when it comes to cancer treatment. It's all very individualized, and the protocols, they're not very often, well, the same between different people. And as you saw just in my case then, I didn't actually need a bone marrow transplant for my subtype of leukemia. However, due to my individual response, after finishing treatment for leukemia and then getting a relapse, the transplant was the next best thing I needed, and thankfully I got it, and I'm going pretty good so far. Now, of course, leukemia isn't the only thing you can use to treat with a bone marrow transplant. You can also use it to treat lymphomas, myeloproliferative disorders, myeloma, aplastic anemia, and some other immune disorders. So how is it that, well, a bone marrow transplant actually works? I'll try my best to explain it for you. What we do essentially is you have chemotherapy and or radiotherapy, and what this is used to do is essentially kill those disease cells, and unfortunately it's not very good at targeting just those disease cells, so what it tends to do is destroy quite a large number of cells, and that includes the stem cells, of which you commonly can see where the problem begins. And in the process of killing these stem cells and those disease cells, what we then do is essentially create this vacuum of space. And with this vacuum of space, if we then give these healthy stem cells that relatively match you, and that's why we get matching for those donors, they essentially fill that space that's now been created through the treatment, and they kind of begin to act as though they are your own cells. So you're kind of... how would I describe it? Here's a good analogy to maybe help you understand. If you imagine an ice cream tub full of the ice cream, let's say for instance, the ice cream has gone a bit bad, what you can essentially do is remove all of that bad ice cream, but you probably need to get rid of some of the good ice cream that's left around with it in order to make sure that the tub is clean and good to be used again. And that's what we kind of do with our chemotherapy and radiotherapy. We're removing the ice cream. And then once we've got the tub nice and clean and ready, we can then use the transplant, or in this situation, another ice cream flavor, and fill it up into that tub. And when it comes to matching for the bone marrow transplant, essentially what we're doing is we're just making sure that those two ice cream tubs are kind of similar size and flavors. That's what the blood matching is, at least in my analogy. And therefore, when we put that new ice cream into the old container, it fits really, really well because we've matched it. And that's kind of what a transplant is and how it works. You make the space, you then... you identify the bad source, you clear it all out, so you have an empty ice cream tub, then you can fill it up with new ice cream that essentially takes place of the old ice cream. Now, what are the types of transplants that can occur? Well, there's mainly two kinds, and they have these funny terms that you'll probably hear, particularly if you come into contact with them, and that is you can have either an autologous transplant or an allogenic transplant. And they're quite large words, but essentially all you need to think of there, when you have autologous, that's auto like an autobiography, so this is a transplant from yourself. Whereas your allogenic, well, that's not the autobiography, that's like the biography, so you're getting those cells from someone else. And they're the two main kinds of stem cells that we use in the bone marrow transplant, either from yourself or from someone else, the donor. Now, how is it that we actually, well, make sure that these transplants kind of match up and work? Let's go through each kind first. So you have an autologous transplant. So these are stem cells from yourself. Well, if you have the cancer in yourself, how do you get a transplant from them to actually treat you? It's kind of a simple way if you look at it, but after undergoing a bit of treatment, you then enter a phase of remission. So this is when you have very low activity or no activity at all of cancer within those cells. What they do at that point is that's when they take the bone marrow from you, and that essentially is not normally that hard needle that extracts stuff out of your bone marrow. No, you take a bit of blood from your veins, essentially like you're donating blood, and you actually have the stem cells circulating in that. Then, after they've got those healthy cells that they got from you while you were in remission, you then undergo further chemotherapy or radiotherapy, and then when you're at that very, well, the ice cream tub's empty, they then return to you those healthy cells that were taken from you during remission, and those are then used as, well, the ice cream filler to hopefully get you back to normal. And that's essentially how an autologous transplant works. We then can move into an allogenic transplant. Now, allogenic transplant, there's a lot of different ways in which you can actually get these donor cells. So you can get it from a sibling or another family member, and you can also have unrelated donors. So an unrelated donor, for instance, in my situation, are my donors from Germany. I don't know who they are, I've never met them, and they're definitely not related to me, but they essentially donated their bone marrow and they saved my life through that. And so that's kind of the top 3 examples of how you can receive those donor cells when it comes to an allogenic transplant. And that's a really important part I want to kind of talk about when it comes to the allogenic transplants, and that is, in most situations, I think it's 90 to 95% of situations, when it comes to you actually having to donate. So if you decided to become a bone marrow donor for someone like myself or someone else, be it a 5-year-old in a hospital, a 50-year-old in a hospital, anybody in a hospital that needs a bone marrow transplant, if you decide to become a donor, most of the things that you're required to do essentially is, beforehand, go donate your blood. And when you're donating your blood, this is in Australia at least, tick the box to say, I would like to be a bone marrow donor. From here on, if they decide to select you, what they essentially do from there is they make sure that you match the patient that they hope to use your donor cells for, and then all they have to do to get them from you is they essentially give you a few injections every day for a few days to stimulate the stem cells within you, and then they just take a bit of blood from you the same way you would when you're giving blood for a blood transfusion drive. And in that blood transfusion bag that they essentially take from you, there are the stem cells that they need for the transplant. And that's a really, really big misconception that I know even I personally had, and I'm trying to communicate as much as I can, particularly here on my channel now, and that is that if you're going to become a bone marrow donor, don't think it's like those movies where they do those big needles into your bone and suck out the marrow. I think it's very, very rarely done like that, and in most situations, it's just like donating a bit of blood, except with a few needles beforehand, just to get a few extra stem cells circulating. And so when you come to think about it, it's really quite a minor inconvenience as to what you are expected to do as a donor, and the ability to then, well, proliferate and save someone's life as a consequence is just... it's surreal. It's kind of unreal to imagine the impact that you can have just by doing that simple process. And I'm very personally attached to this kind of issue, but when you think about it, when we need more people in our society, in our communities, to donate blood because we're in blood shortages, people rush to donate blood. And yet when it comes to bone marrow, it's the exact same process. You just need to go ahead and donate blood. And that's all it really comes down to in most situations. And so I'm making this point to really share that if you're willing to donate blood, you should definitely be willing to donate bone marrow. Because when you're donating blood, you're making a big difference. But when you're donating bone marrow, you're literally saving someone's life. And it's through the same kind of steps that you took to essentially donate your blood. And I would strongly encourage all of you to check if you can, where you are, donate your bone marrow. And yeah, I love you if you do, and I love you if you're thinking about it, and I love you if you're considering it, and if you can't, I love you nonetheless. Yeah, I think it's just such a strong and powerful thing, and I'm really kind of disheartened to think how poorly it's been educated to us, what the actual process of donating bone marrow is kind of like. And I can say that quite strongly because even as a medical student, I didn't know exactly what it was like. And if I'm someone who's actually being trained in the medical field who doesn't know what donating bone marrow is like, I can't expect other people without medical training to expect and understand what it actually is about either. That's why this video here is trying to tell you it's not too bad. Think of it like a blood transfusion, except you're literally saving someone's life who's going through a scary part of their life with cancer, and you have the chance to change that. It's just... I mean, we're looking for a cure to cancer, and we kind of have one already. We just need more people to jump up and try and help us with it too. Yeah, sorry, I get very passionately involved talking about it because I think it's like we have this secret weapon we're not utilizing enough because we're just not well informed enough about it. And I'm going to make a separate video talking about this because I want you to be able to send that video to anyone and everyone who may be a bit concerned about donating bone marrow and they understand exactly what it's like. But moving on, that's what it's like to donate your bone marrow, and that's your allogenic bone marrow transplant. And that's kind of everything I want to talk about today when it comes to what is a bone marrow transplant. You then have all of these other questions that may come around, and that includes, what can I eat during? What's my recovery like? And when do things get back to normal? And I'm really kind of interested to know what your specific questions might be about a bone marrow transplant. And if you have those questions, please put them down so I can actually check what your questions are. And I think what I'd like to do is a big Q&A around bone marrow transplants and kind of answer it in one video. So throw all of your answers you can, all of your questions down below, and that'll make a really interesting and cool video. And I look forward to making that. Otherwise, thank you so much for watching this video today. I hope you've enjoyed it. I hope you've learnt a bit. I definitely enjoyed it. It's a topic I'm very passionate about. Saved my life, so I feel like I owe it to talk about it a little bit more, and I hope you've enjoyed and learned a lot from it too. If you're still here, please like, share, subscribe, and to prove that you are still watching to the end of my video, comment your favorite ice cream flavor down below. Mine is Ben & Jerry's fish food. I absolutely love it. It's just so good. I think when I was a kid, I loved it just because it sounded funny, and then I kind of grew into really liking the flavor. Anyway, I'm interested to read what your favorite ice cream flavors are down below as well. Otherwise, I really look forward to seeing you all in the next video. Thank you so much, and see you then. Bye!